Welcome back to Derm Time. I'm Dr. Heejin Ko.
And I'm Dr. Nkemu Kanabo, and today we're going to be diving into the world of lasers, specifically cosmetic lasers. So we'll talk about all the different types, what they're used for, and what you should know before considering a laser treatment.
Yes, lasers are powerful tools in dermatology, and they can help address multiple skin concerns like acne scars, pigmentation, wrinkles.
So if any of those concerns sound interesting to you, you'll want to tune into this video. So don't forget to follow us, hit that subscribe button, and give this video a thumbs up, please. Let's dive in. So what are cosmetic lasers to begin with? So these are lasers that are focused on light to target specific areas of the skin. So depending on the wavelength and the intensity, they penetrate to different layers of the skin to treat various concerns.
Think of them as highly precise tools that target a specific target, like water, pigmentation, blood vessels, etc. Not all lasers are the same, so it really depends on the specific skin concern that we're trying to address and specific target that we're trying to achieve.
So we'll go into the types of lasers and like what their uses are specifically. So let's start with ablative lasers.
Yes. Ablative lasers like CO2 and erbium lasers are great at removing the top layer of the skin. So they can be very effective for patients with intense sun damage, wrinkles, even scarring.
So now these lasers can offer dramatic results, but with those dramatic results comes more significant downtime and a longer recovery period in general. So you're going to be able to expect things like more redness, more swelling for at least a couple of weeks after the treatment. In contrast, there's another category called non-ablative lasers. And so these are lasers that are targeting deep layers of the skin without ablating or removing that top surface of the skin. And that makes them great for issues such as mild wrinkles, pigmentation, and overall skin texture.
One example of a non-ablative laser that we use often is a fractional laser, like Fractal Dual and Clear Brilliant. So these lasers use like a grid-like pattern, so actually target focal points of energy and leaving the surrounding skin untouched, which helps to heal faster, resulting in less downtime.
Yep. So you get less downtime, and it's really ideal for people who want to improve their skin but don't have like weeks to take off after treatment, but still want to do something that is going to be helpful for their skin, whether it's wrinkles, acne scars, stretch marks, etc. The recovery time overall is less with these types of lasers. Subsequently though, you probably will need more than one session depending on what exactly we're treating to get the best optimal results.
There's also a type of laser that we use that targets blood vessels, like pulse dye laser, PDL, or often called V-beam. It's great for those with rosacea, telangiectasias, or those broken capillaries that we see on our faces, around the nose, around the cheeks. They can be very good at treating those, and even cherry angiomas, which are like little red dots that you kind of see on the body. So it's a great treatment that targets blood vessels.
Yep. And as with many laser types, the PDL will often require multiple treatments, but very effective for just reducing overall redness, and it's usually very well tolerated with minimal downtime as well.
Yep. No numbing required for that.
Yes. In fact, it's actually better not to numb.
Yes. So what kind of laser do you have in your office for like treatment of redness?
Yeah, so we actually like to use multiple lasers at once to like be even more specific. So we do the PDL, which is V-beam specifically, and then we also will do an XLV, a little bit different. It's a KTP laser, but it also targets blood vessels very nicely. And then sometimes we'll do something called a DermaV, which is a newer laser, but it's actually really great at improving redness as well.
Sometimes multiple treatments with multiple devices can lead to better results.
Yeah, because you can like cherry pick and then make it more. The most important thing is to tailor it to the patient.
Correct.
I think
Yes.
so. Like whatever the patient needs, and then you figure out which lasers you can mix together to address their needs.
So when it comes to laser treatments, skin type really matters. You have to take into consideration, are you melanin-rich skin type or are you more fair skin type? Because different lasers with different energy and settings can affect skin of color more so than fairer skin types. For example, if you're using too strong of a laser or inappropriate laser with inappropriate settings, you can get more hyperpigmentation, which is like increase in more discoloration from the laser treatment, burns, etc.
Yeah. I think there's this big misconception misconception out there that I'm sure you've encountered as well, where people with medium or darker skin types feel like they can't do any laser at all. And the reason why that misconception is out there is because some lasers are unsafe in melanin-rich skin, but there are lasers that can be used safely and appropriately in these skin types. So it's just really important, one, to see someone who actually has experience in your skin type and feels comfortable treating it, and two, to choose the right laser. Generally speaking, non-ablative is going to be your best bet in terms of safety, because it's not going to be ablating or removing that top layer of skin. So it's going to be safer for someone who has more pigmented, rich skin and less likely to cause things like hyperpigmentation. For example, you may have seen things go viral where someone had these significant burns and hyper or hypopigmentation from a treatment called BBL or broadband light, or IPL, which stands for intense pulse light. Now, these are light-based devices that you particularly have to be very careful in anyone who has melanin-rich skin. I personally wouldn't even do it on those with darker skin types. So all the more reason why you want to have that consultation and make sure you're talking with your dermatologist or whoever is doing the laser treatment to make sure it's safe in your skin type first.
Sometimes they'll do a test spot if it's something that requires high energy, you know, in caution for burns and stuff.
Yeah, I love doing test spots. I think they're, you know, I think sometimes as a patient, and I can speak because I've been guilty of this myself, you kind of want to jump right to it and it's like treat everything, you know what I mean? But I think there is a benefit to, you know, having a little bit of patience and to just doing a small spot first, just to make sure that the settings are right. And it's so much better to have a sampling of that setting than to do an entire thing and then realize later on, like, oh, maybe we should have gone a little bit lower or higher, etc. So test spots, you'll never regret doing a test spot, honestly. Highly recommend it.
It's better for you.
Better for you, better for the doctor. Test spots are great. So what should you expect before, during, and after your laser treatment? So before, skincare actually does matter because you want to reduce the chances of getting any kind of like reaction or irritation from the laser treatment. So you're probably going to be asked to avoid certain products such as retinoids and exfoliants, which can just make your skin more sensitive. In addition, it's a good idea to avoid significant sun exposure because many of the lasers, at least for me, many of the lasers that I use, we don't want you to be tan. So if you're going to get a lot of sun beforehand and there's even the possibility of a tan, that can just increase the risk of things going awry. So you want to limit sun exposure and limit products that can make your skin more sensitive.
What to expect during laser treatment? Obviously, each laser is going to give you a different feeling, pain level, and etc. I would say we do numb anything, any lasers, you know, that we think will cause any type of pain whatsoever. We will numb you beforehand, and we use a numbing cream, and usually patients apply the numbing cream and they stay with that on for about 30 minutes or so, sometimes even a little bit longer. And I would say they'll probably feel a little bit of prickly sensation, possible to feel some heat, and you know, that's definitely with certain fractional lasers, you'll feel a lot of heat. Some patients, they feel kind of like a cold air or cold snapping sensation, and that's attached to the laser, which helps to kind of alleviate the pain also. So really depends on the type of the laser treatment that you're going for, but we'll be prepping you appropriately.
And then post-care. So post-care is super important.
Oh, so important.
Yes, not just to maintain safety, but even to like optimize your results. So one thing to note, just expect some redness, expect some swelling, maybe peeling, depending on which laser you did exactly. And you want to follow your dermatologist or whoever you're seeing's advice to the T in terms of their instructions, because they're going to make recommendations such as like using a gentle cleanser, applying certain hydrating products because your skin will be more sensitive and more prone to dryness. Avoiding the sun is another thing that I will often tell patients to do post-laser. But yeah, think of it as immediately after laser treatment, your skin is 10 times more sensitive than it was before. So you're going to want to treat it with extra TLC, extra love, extra comfort, which for me usually means gentle, 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 and hydrate, 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 and stay out of the sun.
Sun protection, probably the most important thing, because a lot of these lasers, they target pigment. And if we want to protect the skin, the new skin, you know, that you're going to get after laser treatment, always, always, always sun protection. Sunscreen, staying out of the sun, wearing a hat, etc.
Yes, yes. And when we say things like wear sunscreen, please know that, you know, this could be a whole video in itself and I'm not going to go off, but like at least SPF 30, you know, no, anything less than 30 is not going to be enough. enough in terms of adequate protection. You want to really like make sure you're using enough of it post-treatment. But yeah. Have you had a laser treatment before?
Oh yeah, I mean, I like to try different types of lasers before I even offer it to patients.
Yeah.
So I want to know exactly how much it hurts, whether the numbing cream does its job, how much of a downtime that it actually takes, you know, because my skin is pretty sensitive.
Yeah.
Also, as skin of color, I have to protect it so that I don't get rebound pigmentation. But yeah, I've done fractional lasers, like Fraxel I've done, Clear and Brilliant, V-Beam, Alex, Pico. I've done a lot. And they're all different, I would say. Some I like more than the others. Mostly not just for results, but also the downtime and the pain level.
I think a lot of us in the New York / Jersey area, we can't stomach a lot of downtime, so we're often going for the lower recovery time lasers. Yeah, I mean, I always tell people like Clear and Brilliant, for example. Oh, is it painful? I'd say you'll feel something. It's prickly. You know?
Oh yeah, I know.
I still numb, but
weird prickly sensation if you're not numbing. So I would numb.
I would numb, but it's tolerable.
Yes,
it's not like this crazy intense thing that most people can't stomach. I think it's very tolerable. In contrast, Fraxel does hurt more, and we will numb. At least in my office, we will numb you much longer for Fraxel than we would for Clear and Brilliant because we know that pain is more intense.
No, with Fraxel, I mean, obviously it depends on the intensity of the treatment, but I remember feeling like tomato hot the whole day after. And I think I bought this ice cream pack on my way home because it was so hot and I didn't have ice pack. Like if you have ice pack, it's awesome because it'll cool down your face. But it melted that ice cream like my face did. So that's how hot it was.
Was it worth it after you recovered? Was it worth it?
Yeah, I mean, I think it's a great treatment. You'll see results for sure. You will definitely see like clearer skin. Obviously, if you're targeting more collagen stimulation or wrinkles, that will take time to see the result. But yeah, pigmentation wise, you'll definitely see improvement, but you need really, really strong sun protection.
Yeah.
Because even with like a lot of sunscreen usage, like your skin can still be more vulnerable.
Which is why I think the fall / winter tends to be a more popular time for these laser treatments. Because it's just hard, practically speaking, it's just harder to avoid the sun in, May, June than it is in like November,
December. Fall, winter is the perfect time for lasers.
I should probably do one next week.
So lasers are generally safe, but of course there are side effects or adverse reaction in some patients, like hyperpigmentation. I think we kind of touched upon that.
Yeah.
That's probably the most common. Then in some fractional lasers, like cold sore reactivation, we do see that. So we kind of prep you with medication to prevent that from happening. Certain lasers, like, I don't know, I didn't think we talked about it, but like halo laser, you can get acne flare-ups. So that's another thing that we do kind of prep you for. And I guess scarring in some patients, but that's not that common, I would say.
Yeah. So I think the most important thing is when you have that consultation appointment with the doctor or whoever professional is doing the laser treatment, you want to be really candid and open about your medical history, anything that makes your skin more sensitive, any medications that you're taking, etc., because that will help them be better equipped to do any sort of pre-treatments that you might need. So just make sure that you're pretty open and honest, and so that's why they can take that into account. So for example, if you have a cold sore history, like you've had cold sores come up in the past, which is very common, right? You do want to tell the doctor because they might give you something to suppress the risk of that happening with the laser, because heat in general can trigger cold sores. So if you're prone to cold sores, you'll probably get a medication prior to the laser treatment just to reduce the risk of that happening. So that's why it's important to be open about your medical history. But other than that, it tends to be generally well-tolerated procedures in the best of hands.
We hope this overview helped you understand different types of lasers and how they can be used to help address different skin concerns.
So remember, lasers are powerful tools, but they are not one size fits all. So if you're considering a treatment, you want to consult with the dermatologist and take the time to have that conversation prior to your treatment so that they can guide you to the best option for your unique skin.
And if you found this video helpful, just give us thumbs up, hit subscribe, and let us know in the comments if you have any questions.
And we'll be happy to answer them. Thanks for watching, and stay tuned for more skincare and dermatology insights here on Derm Time. Bye!